I enjoy watching the Dr. Phil show from time to time. He has some very good points. One of my favorite is his comment about no matter how thin you make a pancake, there's always two sides to it. That talks about point of view. The one thing I have a little problem with is when he has someone on the show that has a serious problem with drugs or alcohol or some other thing. The only thing he says more than how's that working for you is we'll be able to get you some treatment. Well, that's well and good for the guests he has on the show. But how many people out there with the same condition have no resources to go to the hacienda or to go to a psychiatrist or go to a inpatient or even outpatient treatment? I wish that he would bring up the fact that there's therapy for a buck out there. May not work for everybody, but it's a place to start. There are 12-step programs out there. There are other groups out there that can help an individual with these personal problems. And I say therapy for a buck is because we usually always pass a basket in the 12-step program. That's just to pay for our own meeting place, our own coffee, our own donuts. We don't accept outside contributions. We command to pay rent wherever we have a meeting. So we have no allegiance to the person. We don't have to follow what they say. We rent a room for the evening and they have to let us do what we want, at least within their rules. We don't accept government money. I'm sure we could. We don't advertise, which I'm sure we could. We could endorse different treatment centers and make a lot of money. But we don't. Because it's not good for us. Our primary purpose is to stay sober and help others to recover. It works quite well. But it's still therapy for a buck. Because normally people throw $1 in the basket. But please understand, you can get it without that.